Question 1. A practical nurse, PN, is caring for a client newly diagnosed with type 2 diabetes who expresses overwhelming anxiety about managing their condition. The client states, "I don't know where to start with all this diet and medication stuff." What is the most appropriate initial action for the PN? A. Provide a detailed printed list of recommended dietary changes and medication schedules. B. Refer the client immediately to a registered dietitian and an endocrinologist. C. Assess the client's current understanding, learning style, and most pressing concerns. D. Reassure the client that managing diabetes is easy with proper guidance and support. Answer: C. Assess the client's current understanding, learning style, and most pressing concerns. The concept tested here is the initial step of the nursing process, specifically assessment, in the context of client education. The keywords "most appropriate initial action" highlight the need to gather information before intervening. Before providing any education or making referrals, the practical nurse must first understand what the client already knows, what specific worries they have, and how they best learn, which allows for individualized and effective teaching. For example, if the client is worried about managing insulin injections, the PN can then focus education on that specific skill. Starting with an assessment ensures the education is tailored to the client's immediate needs and readiness to learn, promoting better understanding and adherence. Question 2. A 78-year-old client with advanced Alzheimer's disease frequently attempts to wander out of the long-term care facility. The care team discusses implementing a restraint to ensure the client's safety. Before applying any restraint, what ethical principle must the practical nurse prioritize? A. Beneficence. B. Non-maleficence. C. Autonomy. D. Justice. Answer: C. Autonomy. This question explores the ethical principle of autonomy, particularly when considering the use of restraints. The key phrase, "before applying any restraint," emphasizes the preeminent ethical consideration in such situations. While beneficence, doing good, and non-maleficence, doing no harm, are important, the client's right to make their own choices, or autonomy, must be respected as much as possible, even with cognitive impairment, by exploring less restrictive alternatives first. For instance, the PN should look for triggers for wandering or try to engage the client in meaningful activities before resorting to physical restraints. Always prioritize the least restrictive measures and ensure all other options have been exhausted and documented before compromising a client's autonomy. Question 3. A practical nurse is reviewing a client's medication list and notes a new prescription for metoprolol, a beta blocker, for a client with a history of asthma. What is the most important action for the PN to take before administering the medication? A. Administer the medication as prescribed and monitor for side effects. B. Contact the prescriber to clarify the order due to the client's history of asthma. C. Educate the client about common side effects of metoprolol, such as dizziness. D. Assess the client's blood pressure and heart rate immediately before administration. Answer: B. Contact the prescriber to clarify the order due to the client's history of asthma. The core concept here is medication safety and recognizing potential contraindications. The key phrase, history of asthma, coupled with the new prescription for metoprolol, a beta blocker, is a critical red flag, as beta blockers can cause bronchospasm and exacerbate asthma. The most important initial action for the PN is to clarify the order with the prescriber because the medication could potentially harm the client given their existing condition. For example, a non-selective beta blocker could severely worsen a client's asthma symptoms. Always question any medication order that appears to be contraindicated or potentially harmful to a client. Question 4. A client reports acute, severe pain after a fall, rating it as 9 out of 10 on a pain scale. The client has a standing order for oral opioid analgesic as needed, PRN. The practical nurse notes the client's respiratory rate is 10 breaths/minute and shallow. What is the most appropriate action for the PN? A. Administer the oral opioid analgesic as prescribed and reassess pain in 30 minutes. B. Elevate the client's legs and apply oxygen via nasal cannula. C. Hold the opioid analgesic and notify the registered nurse, RN, or prescriber immediately. D. Administer a non-opioid analgesic and apply a cold pack to the painful area. Answer: C. Hold the opioid analgesic and notify the registered nurse, RN, or prescriber immediately. This question assesses the practical nurse's critical thinking and ability to prioritize client safety, specifically regarding medication administration and adverse effects. The key information is the client's respiratory rate of 10 breaths/minute and shallow, which indicates respiratory depression, a serious side effect of opioid analgesics. Administering more opioid would worsen this life-threatening condition. Therefore, the most appropriate action is to hold the medication and promptly escalate the concern to an RN or prescriber for further assessment and intervention. This ensures the client's immediate safety from potential respiratory arrest. Question 5. A practical nurse is caring for a client who is 2 days post-operative following abdominal surgery. The client reports increasing incisional pain, is refusing to ambulate, and has diminished bowel sounds. Which of the following findings is the most significant indicator of a potential complication that requires immediate attention? A. Client refusal to ambulate due to pain. B. Diminished bowel sounds. C. Oral temperature of 38.5 degrees Celsius 101.3 degrees Fahrenheit. D. Serosanguinous drainage on the dressing. Answer: C. Oral temperature of 38.5 degrees Celsius 101.3 degrees Fahrenheit. This question tests the practical nurse's ability to prioritize assessment findings in a post-operative client. While refusal to ambulate, diminished bowel sounds, and serosanguinous drainage are important observations, an oral temperature of 38.5 degrees Celsius 101.3 degrees Fahrenheit is the most significant indicator of a potential infection or inflammatory process, which is a serious complication requiring immediate attention. The keyword "most significant indicator" points to the need to identify the finding with the highest potential for harm. Prompt recognition of fever in the postoperative period can lead to early intervention and prevention of further complications like sepsis. Always prioritize vital sign abnormalities that suggest an active infection or inflammation. Question 6. A practical nurse is performing a skin assessment on a client admitted from a long-term care facility. The PN notes a red, non-blanchable area on the client's sacrum that is intact. The client reports no pain in the area. How should the PN document this finding? A. Stage 1 pressure injury. B. Suspected deep tissue injury. C. Unstageable pressure injury. D. Non-pressure related skin irritation. Answer: A. Stage 1 pressure injury. This question assesses the PN's knowledge of pressure injury staging. The key characteristics are red, non-blanchable area and intact skin on a bony prominence like the sacrum. These findings are the hallmark definition of a stage 1 pressure injury, indicating persistent redness that does not turn white when pressed, even though the skin is not broken. It's crucial to correctly identify and document pressure injuries for appropriate intervention and prevention of worsening. For example, repositioning and pressure-reducing surfaces are vital interventions at this stage to prevent further skin breakdown. Accurately staging pressure injuries is the first step in effective wound care. Question 7. A practical nurse is preparing to administer medications to an older adult client who has difficulty swallowing pills. The client's medication list includes a potassium supplement, tablet, and a liquid antidepressant. What is the most appropriate action for the PN? A. Crush both medications and mix them with applesauce for easier administration. B. Administer the liquid antidepressant and then ask the pharmacist if the potassium tablet can be changed to a liquid form. C. Advise the client to tilt their head back slightly when swallowing the tablet to prevent choking. D. Offer the client a large glass of water to take with the tablet, encouraging them to take multiple sips. Answer: B. Administer the liquid antidepressant and then ask the pharmacist if the potassium tablet can be changed to a liquid form. This question tests the practical nurse's knowledge of medication administration safety and client-centered care for those with dysphagia, difficulty swallowing. The keyword "most appropriate action" highlights the need for a safe and effective solution. While liquid medications are suitable, not all tablets can be crushed, especially sustained-release or enteric-coated ones like many potassium supplements, which can alter drug absorption and cause harm. Therefore, administering the safe liquid medication and then consulting the pharmacist about the tablet's form is the correct and safest approach. This ensures the client receives their medication safely without compromising its effectiveness or causing adverse effects. Question 8. A client with a new colostomy expresses fear and embarrassment about managing the stoma, stating, "I don't think I'll ever get used to this." What is the most therapeutic response by the practical nurse? A. Many people adjust well, you'll get the hang of it eventually. B. It sounds like you're feeling overwhelmed right now. What are your biggest concerns? C. Don't worry, I'll teach you everything you need to know about caring for your colostomy. D. Perhaps a support group would be helpful for you to connect with others. Answer: B. It sounds like you're feeling overwhelmed right now. What are your biggest concerns? This question focuses on therapeutic communication skills, specifically active listening and validating feelings. The client expresses fear and embarrassment and feeling overwhelmed. The most therapeutic response acknowledges their feelings and invites them to elaborate on their specific concerns, which is key for building rapport and identifying their individual needs. Simply offering reassurance or facts without addressing the client's emotional state can feel dismissive. For example, if the client is most concerned about odor, the PN can then provide targeted education and solutions. Always start by validating the client's emotions before jumping into solutions or advice. Question 9. A practical nurse is caring for a client with a nasogastric (NG) tube inserted for gastric decompression. The client complains of abdominal cramping and nausea. Upon assessment, the PN notes the NG tube is patent, and there is minimal drainage. What is the most appropriate initial action for the PN? A. Irrigate the NG tube with 30 milliliters of normal saline. B. Reposition the client to the left side and re-evaluate in 15 minutes. C. Increase the suction setting on the NG tube. D. Auscultate bowel sounds and assess for abdominal distension. Answer: D. Auscultate bowel sounds and assess for abdominal distension. This question tests the practical nurse's problem-solving skills within the nursing process, specifically prioritizing assessment. The client's symptoms of abdominal cramping and nausea with minimal drainage from a patent NG tube suggest a potential issue like an obstruction or altered bowel function. The most appropriate initial action is to further assess the client's abdomen, including auscultating bowel sounds and checking for distension, to gather more data before intervening. This comprehensive assessment helps identify the root cause of the symptoms, guiding the next steps, such as irrigation if an obstruction is suspected. Always gather more data when symptoms don't align with expectations or suggest a new problem. Question 10. A practical nurse is assisting with the discharge planning for an older adult client who lives alone and is recovering from a hip fracture. The client is worried about performing daily activities at home. What is the most important consideration for the PN during discharge planning to ensure a safe transition? A. Ensuring the client has a follow-up appointment with the surgeon. B. Providing written instructions for pain management and wound care. C. Arranging for a home safety assessment and home care support. D. Reviewing dietary needs and recommending nutritional supplements. Answer: C. Arranging for a home safety assessment and home care support. This question assesses the practical nurse's understanding of comprehensive discharge planning, especially for vulnerable clients. The keywords older adult client who lives alone and recovering from a hip fracture highlight the significant risk for falls and difficulty with activities of daily living at home. The most important consideration is ensuring a safe environment and adequate support. Arranging for a home safety assessment and home care support directly addresses the client's stated worry about performing daily activities and prevents readmission due to complications from an unsafe environment. While other options are important, ensuring physical safety and functional support is paramount for this client's successful transition home. Question 11. A practical nurse is assigned to care for a group of clients on a medical unit. Which of the following tasks is appropriate for the PN to delegate to an unregulated care provider, UCP? A. Administering oral medications to a stable client. B. Performing an initial assessment on a newly admitted client. C. Assisting a client with personal hygiene and ambulation. D. Developing a plan of care for a client with complex needs. Answer: C. Assisting a client with personal hygiene and ambulation. This question tests the practical nurse's understanding of delegation principles and the scope of practice for unregulated care providers, UCPs. The concept is the 5 rights of delegation: right task, right circumstances, right person, right direction/communication, right supervision. Administering medications, performing initial assessments, and developing care plans fall within the scope of practice for regulated health professionals, PNs or RNs, due to the need for critical thinking, assessment, and judgment. Assisting with personal hygiene and ambulation are tasks that are typically within a UCP's scope for stable clients under the supervision of a PN or RN. Always consider the complexity, stability of the client, and need for nursing judgment when delegating. Question 12. A client receiving total parenteral nutrition, TPN, suddenly develops a fever, chills, and tachycardia. The practical nurse notices redness and swelling at the central venous access device, CVAD, insertion site. What is the most appropriate initial action for the PN? A. Slow the TPN infusion rate and monitor vital signs closely. B. Remove the CVAD immediately and apply pressure to the site. C. Obtain blood cultures and notify the registered nurse, RN, or prescriber. D. Administer a PRN dose of acetaminophen for the fever. Answer: C. Obtain blood cultures and notify the registered nurse, RN, or prescriber. This question assesses the practical nurse's ability to recognize signs of a central line-associated bloodstream infection, CLABSI, and prioritize appropriate interventions. The symptoms of fever, chills, tachycardia, combined with redness and swelling at the CVAD insertion site, are highly indicative of an infection. The most appropriate initial action is to obtain blood cultures before administering antibiotics, which would skew culture results, and immediately notify the RN or prescriber for further orders, including potential CVAD removal and antibiotic therapy. Delaying these actions could lead to rapid deterioration in the client's condition. Always prioritize identifying and reporting potential bloodstream infections promptly. Question 13. A practical nurse is preparing to teach a group of older adults about fall prevention in their homes. Which of the following strategies is most important to include in the teaching plan? A. Encouraging daily moderate intensity exercise to improve balance. B. Recommending installation of grab bars in bathrooms and stair railings. C. Advising regular vision and hearing checks. D. Reviewing all medications for potential side effects that increase fall risk. Answer: D. Reviewing all medications for potential side effects that increase fall risk. This question tests the practical nurse's ability to identify the most impactful intervention in a health promotion context, specifically fall prevention in older adults. While exercise, grab bars, and sensory checks are important, reviewing all medications for side effects that increase fall risk, e.g., dizziness, drowsiness, orthostatic hypotension, is often the most critical and often overlooked strategy. Polypharmacy is a significant risk factor for falls in older adults. For example, medications like sedatives or antihypertensives can directly impair balance or cause sudden drops in blood pressure. Always prioritize medication review as a primary fall prevention strategy. Question 14. A practical nurse is caring for a client with end-stage heart failure who is experiencing severe dyspnea and anxiety. The client has expressed a wish to focus on comfort care. What is the most appropriate nursing intervention for the PN to provide? A. Encourage the client to deep breathe and cough regularly. B. Administer oxygen via a non-rebreather mask at 15 liters per minute. C. Position the client in a high Fowler's position and administer prescribed anxiolytics and opioids for symptom management. D. Prepare the client for immediate transfer to the intensive care unit for aggressive treatment. Answer: C. Position the client in a high Fowler's position and administer prescribed anxiolytics and opioids for symptom management. This question focuses on palliative and end-of-life care, specifically symptom management when comfort is the primary goal. The client's desire to focus on comfort care and symptoms of severe dyspnea and anxiety are key. The most appropriate intervention involves positioning to ease breathing and administering medications specifically aimed at alleviating distress, such as anxiolytics for anxiety and opioids for dyspnea, which are standard in palliative care. Aggressive oxygen, deep breathing exercises, if fatiguing, or transfer to ICU contradict the comfort care goal. Always prioritize symptom relief and client wishes in palliative care. Question 15. A client asks the practical nurse for information about their neighbor, who is also a client in the hospital. The client states, "We're close friends, and I'm just worried about them." What is the most appropriate response by the PN? A. I can't provide specific information about other clients due to privacy regulations. B. Your friend is stable, but I can't discuss details due to privacy. C. I understand your concern, but I can't confirm if that person is even a client here. D. Perhaps you could call your friend directly when they are able. Answer: A. I can't provide specific information about other clients due to privacy regulations. This question addresses a core legal and ethical principle in nursing: client confidentiality and privacy. The keyword is information about their neighbor, which falls under protected health information. The most appropriate response is to clearly state the inability to share any client information due to privacy regulations, without confirming or denying the person's client status or giving any hint of their condition. This upholds the Personal Health Information Protection Act, FIPA, or equivalent provincial privacy legislation. For example, simply saying, "I can't share any information about other clients" protects privacy effectively. Always err on the side of caution and uphold strict client confidentiality. Question 16. A practical nurse is reinforcing teaching with a client who is prescribed a new oral antibiotic. Which statement by the client indicates a need for further teaching? A. I need to take this medication with food to prevent an upset stomach. B. I should finish all the medication, even if I start feeling better. C. If I miss a dose, I should take 2 pills next time to catch up. D. I will report any new rashes or difficulty breathing to my doctor. Answer: C. If I miss a dose, I should take 2 pills next time to catch up. This question assesses the practical nurse's ability to evaluate client understanding of medication education. The statement, "If I miss a dose, I should take 2 pills next time to catch up," indicates a significant misunderstanding. Taking a double dose of medication can lead to toxicity or severe side effects, especially with antibiotics. The other statements demonstrate correct understanding of common antibiotic instructions. It is crucial to reinforce that clients should follow specific instructions for missed doses, which typically involve taking the missed dose as soon as remembered unless it's almost time for the next dose, but never doubling up. Always clarify specific instructions for missed doses to prevent harm. Question 17. A practical nurse is preparing to administer an intramuscular, IM, injection to an adult client. The medication volume is 3 milliliters. Which muscle site is the most appropriate for this injection? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Vastus lateralis. Answer: B. Ventrogluteal. This question tests the practical nurse's knowledge of safe injection practices and site selection. The keyword "most appropriate" for an adult client and a 3 milliliters volume is crucial. The ventrogluteal site is generally considered the safest and most preferred IM injection site for adults due to its thick muscle, distance from major nerves and blood vessels, and ability to accommodate larger volumes, up to 3 milliliters. The deltoid is limited to smaller volumes, typically up to 1 milliliter. The dorsogluteal site carries a risk of sciatic nerve injury, and while the vastus lateralis can take up to 3 milliliters, the ventrogluteal is often preferred due to fewer major vessels/nerves. Always choose the safest and most appropriate site for the medication volume. Question 18. A practical nurse is performing a neurological assessment on a client following a head injury. The client's Glasgow Coma Scale, GCS, score decreases from 13 to 10 over 2 hours. What is the immediate priority action for the PN? A. Document the findings in the client's chart. B. Increase the frequency of neurological assessments. C. Notify the registered nurse, RN, or prescriber immediately. D. Reposition the client to promote airway patency. Answer: C. Notify the registered nurse, RN, or prescriber immediately. This question assesses critical thinking and prioritization in a deteriorating client condition. A decrease in Glasgow Coma Scale, GCS, from 13 to 10 signifies a significant neurological deterioration, indicating a worsening head injury. This is a medical emergency. While documenting and increasing assessment frequency are important, the immediate priority is to notify the registered nurse, RN, or prescriber, as prompt medical intervention is required to prevent further neurological damage or respiratory compromise. For example, this change might indicate increasing intracranial pressure requiring urgent neurosurgical evaluation. Always escalate significant changes in a client's neurological status immediately. Question 19. A practical nurse is caring for a client with a new peripherally inserted central catheter, PICC, line. What is the most important instruction for the PN to give to the client regarding PICC line care at home? A. You can take a shower, but you must keep the dressing dry. B. Change the dressing daily using sterile technique. C. Avoid lifting heavy objects or performing strenuous activities with that arm. D. Flush the line daily with saline even if it's not being used for infusions. Answer: C. Avoid lifting heavy objects or performing strenuous activities with that arm. This question tests the practical nurse's knowledge of PICC line management and client education for home care. The keyword most important instruction points to prevention of complications. While keeping the dressing dry and daily flushing, if prescribed, are important, avoiding heavy lifting or strenuous activities with the PICC arm is crucial to prevent mechanical complications such as catheter dislodgement, fracture, or vein irritation. Excessive strain on the arm can damage the line or the vein, leading to serious issues. For example, lifting a heavy grocery bag could cause the PICC to migrate or kink. Always emphasize activity restrictions to protect the integrity of the PICC line. Question 20. A client with chronic obstructive pulmonary disease, COPD, is prescribed oxygen therapy at 4 liters per minute via nasal cannula. The practical nurse observes the client is restless, confused, and has increased work of breathing. What is the most appropriate initial action for the PN? A. Increase the oxygen flow rate to 6 liters per minute to improve oxygenation. B. Reassess the client's respiratory rate, oxygen saturation, and lung sounds. C. Encourage the client to deep breathe and cough to clear secretions. D. Administer a PRN dose of bronchodilator as ordered. Answer: B. Reassess the client's respiratory rate, oxygen saturation, and lung sounds. This question tests the practical nurse's critical thinking and assessment skills in a client with COPD who is exhibiting signs of worsening respiratory distress. The symptoms of restless, confused, and increased work of breathing indicate a potential change in respiratory status. The most appropriate initial action is to perform a comprehensive reassessment of respiratory parameters, as this provides crucial data to identify the cause of deterioration before intervening. Increasing oxygen without assessment could be harmful in COPD, and while bronchodilators may be needed, a thorough assessment is foundational to guide the correct intervention. Always conduct a thorough assessment before implementing new interventions in a deteriorating client. Question 21. A practical nurse is performing wound care for a client with a chronic leg ulcer. The PN notes purulent drainage, a foul odor, and increasing redness around the wound edges. What is the most important next action for the PN? A. Continue with routine wound care and reevaluate in 24 hours. B. Apply a warm compress to the area to promote circulation. C. Obtain a wound culture and notify the registered nurse, RN, or prescriber. D. Irrigate the wound thoroughly with normal saline and redress. Answer: C. Obtain a wound culture and notify the registered nurse, RN, or prescriber. This question assesses the practical nurse's ability to recognize signs of wound infection and prioritize appropriate interventions. The keywords purulent drainage, foul odor, and increasing redness are classic indicators of a localized wound infection. The most important next action is to obtain a wound culture to identify the causative organism, and then immediately notify the RN or prescriber so that appropriate antibiotic therapy can be initiated. Continuing routine care or applying a warm compress would delay necessary treatment for the infection. Prompt identification and reporting of wound infections are crucial to prevent systemic complications. Question 22. A practical nurse is caring for a client with a history of heart failure. The PN notes the client has gained 2 kilograms for 0.4 pounds in 24 hours, reports shortness of breath, and has bilateral pitting edema in the ankles. What is the most important intervention for the PN to implement? A. Administer a prescribed PRN diuretic. B. Restrict oral fluid intake to 1,000 milliliters per day. C. Elevate the client's legs and encourage ambulation. D. Assess the client's daily dietary sodium intake. Answer: A. Administer a prescribed PRN diuretic. This question tests the practical nurse's ability to recognize signs of fluid volume overload in a client with heart failure and prioritize the most direct intervention. The 2 kilograms weight gain in 24 hours, shortness of breath, and bilateral pitting edema are classic symptoms of worsening heart failure and fluid retention. Administering a prescribed PRN diuretic directly addresses the excess fluid, which is the immediate cause of the client's distress. While dietary sodium and fluid restrictions are important long-term management strategies, the most important immediate intervention to alleviate acute symptoms is typically diuresis. This helps prevent further fluid accumulation and respiratory distress. Question 23. A client admitted with pneumonia is prescribed oxygen therapy via nasal cannula at 2 liters per minute. The client's oxygen saturation is 90% and respiratory rate is 24 breaths/minute. The client states, "I'm having trouble breathing." What is the most appropriate initial action for the practical nurse? A. Encourage the client to cough and deep breathe. B. Increase the oxygen flow rate to 4 liters per minute. C. Reassess the client's lung sounds and work of breathing. D. Notify the registered nurse, RN, or prescriber immediately. Answer: C. Reassess the client's lung sounds and work of breathing. This question assesses the practical nurse's critical thinking in a client experiencing respiratory distress. The client's statement, "I'm having trouble breathing," requires immediate attention, even with an oxygen saturation of 90%. While increasing oxygen or notifying the RN may be necessary, the most appropriate initial action is always to conduct a thorough reassessment. This involves checking lung sounds, observing the pattern and effort of breathing, and assessing for accessory muscle use, which provides vital information to determine the cause of the distress and guide subsequent interventions. This ensures interventions are targeted and effective, based on comprehensive data. Question 24. A practical nurse is providing care for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. The client repeatedly asks for a drink of water, stating they are very thirsty. What is the most appropriate action for the PN? A. Offer the client a small amount of ice chips to moisten their mouth. B. Explain that drinking water could lead to complications during surgery. C. Provide a straw for the client to sip a small amount of water slowly. D. Distract the client with conversation and avoid discussing water. Answer: B. Explain that drinking water could lead to complications during surgery. This question tests the practical nurse's understanding of NPO status and client education. The concept is adherence to NPO guidelines for surgical safety. The most appropriate action is to clearly explain why the client cannot drink, specifically that it could lead to serious complications like aspiration during anesthesia. While empathy for thirst is important, providing anything by mouth, even ice chips, violates the NPO order and poses a safety risk. A clear, concise explanation helps the client understand the importance of the restriction, promoting adherence and ensuring their safety during the procedure. Always prioritize client safety and clear communication regarding NPO status. Question 25. A practical nurse is caring for a client with a new order for a blood transfusion. Before initiating the transfusion, what is the most critical action for the PN to perform? A. Verify the client's identity and blood product with another regulated health professional. B. Assess the client's vital signs and obtain baseline laboratory results. C. Educate the client about potential signs of a transfusion reaction. D. Ensure a patent intravenous access site is established with appropriate gauge. Answer: A. Verify the client's identity and blood product with another regulated health professional. This question focuses on the most critical safety step before a blood transfusion. The concept is prevention of wrong blood to wrong client errors, which can be fatal. The most critical action is the dual verification process of client identity and blood product details, blood type, unit number, expiry date, with another regulated health professional at the bedside. This double check is a mandatory safety measure designed to catch any discrepancies before the transfusion begins. While the other options are important, this specific verification prevents the most catastrophic errors. Always remember that 2 regulated health professionals must verify blood products at the bedside. Question 26. A practical nurse is caring for a client who has expressed cultural beliefs that may impact their care, specifically preferring traditional healing remedies over prescribed Western medications. What is the most appropriate initial action for the PN? A. Instruct the client that traditional remedies may interfere with prescribed medications. B. Document the client's beliefs and proceed with administering prescribed medications. C. Acknowledge the client's beliefs and ask how they prefer to incorporate their traditional practices into their care. D. Advise the client to discuss their cultural beliefs with the prescriber during their next visit. Answer: C. Acknowledge the client's beliefs and ask how they prefer to incorporate their traditional practices into their care. This question assesses the practical nurse's commitment to cultural safety and client-centered care. The key is the client's expressed cultural beliefs that may impact their care. The most appropriate initial action is to respectfully acknowledge their beliefs and then engage them in a conversation about how they wish to integrate traditional practices with their prescribed care. This demonstrates cultural humility, builds trust, and allows for collaborative decision-making, rather than dismissing or challenging their beliefs. For example, some remedies might be compatible or used at different times. Always explore how clients wish to integrate their cultural practices into their care plan. Question 27. A practical nurse is assessing a client who is experiencing an acute anxiety attack. The client is hyperventilating, reporting dizziness, and tingling in their fingers. What is the most appropriate initial intervention for the PN? A. Encourage the client to take rapid, shallow breaths. B. Administer an anxiolytic medication as prescribed. C. Provide a paper bag for the client to breathe into. D. Encourage slow, deep breaths, and guide them in diaphragmatic breathing. Answer: D. Encourage slow, deep breaths, and guide them in diaphragmatic breathing. This question tests the practical nurse's immediate intervention for hyperventilation caused by anxiety. Hyperventilation leads to excessive exhalation of carbon dioxide, causing respiratory alkalosis and symptoms like dizziness and tingling. The most appropriate initial intervention is to help the client slow their breathing and increase carbon dioxide retention by guiding them in slow, deep, diaphragmatic breaths. While a paper bag was traditionally used, current guidelines favor controlled breathing exercises due to concerns about hypoxemia. An anxiolytic may be needed, but breathing techniques are a primary immediate nursing intervention. Teaching controlled breathing directly addresses the physiological cause of the symptoms. Question 28. A practical nurse is documenting an incident where a client fell out of bed despite bed alarms being set. The client sustained no apparent injury. What is the most appropriate action for the PN regarding documentation? A. Document that the client fell out of bed, no injuries noted, and complete an incident report separately. B. Document the fall, assessment findings, interventions, and client's response in the chart, and also complete an incident report. C. Document the fall in the incident report only, to avoid legal implications in the client's chart. D. Document the fall as an unplanned descent to the floor to avoid negative terminology. Answer: B. Document the fall, assessment findings, interventions, and client's response in the chart, and also complete an incident report. This question addresses accurate and complete documentation of an incident. The core concept is that factual information about an event affecting a client must always be documented thoroughly in the client's chart, describing the fall, the assessment findings, any interventions, and the client's response. Additionally, an internal incident report, also known as a variance or quality assurance report, is completed for quality improvement purposes and is separate from the client's legal health record. The chart entry should be objective and factual, not using euphemisms like unplanned descent. Proper documentation protects the client and the nurse and supports quality improvement. Question 29. A practical nurse is performing health promotion teaching for a group of young adults about sexually transmitted infections, STIs. Which of the following statements indicates the most accurate understanding of STI prevention? A. Using birth control pills prevents STIs. B. I should get tested for STIs only if I have symptoms. C. Consistent and correct use of condoms is the best way to prevent STIs. D. Having only one sexual partner guarantees I won't get an STI. Answer: C. Consistent and correct use of condoms is the best way to prevent STIs. This question assesses the practical nurse's knowledge of effective STI prevention strategies and the ability to identify accurate client understanding. The statement "consistent and correct use of condoms is the best way to prevent STIs" reflects the most accurate and widely accepted method for reducing the risk of transmission. Birth control pills prevent pregnancy, not STIs, and testing should occur even without symptoms due to asymptomatic infections. Monogamy can reduce risk but does not guarantee STI prevention unless both partners are tested and negative. Emphasizing correct condom use empowers individuals with a practical and highly effective prevention tool. Question 30. A practical nurse is caring for a client who is terminally ill and whose family is struggling to accept the prognosis. The family repeatedly asks the PN if there's anything else that can be done. What is the most appropriate response by the PN? A. The medical team has done everything possible, now we focus on comfort. B. It's difficult, but sometimes we just have to accept what's happening. C. What are your specific concerns, and how can we support you and your loved one at this time? D. Would you like me to arrange a meeting with the doctor to re-explain the prognosis? Answer: C. What are your specific concerns, and how can we support you and your loved one at this time? This question assesses the practical nurse's empathetic communication skills and ability to support families in difficult palliative care situations. The family's repeated questioning suggests they are struggling with grief and the finality of the prognosis. The most appropriate response is to open a dialogue that allows them to express their specific concerns and offer support, rather than providing definitive answers that might feel dismissive. This approach encourages open communication, helps identify their needs, and validates their feelings. For example, they might be worried about pain, or having enough time to say goodbye. Providing a safe space for their questions and emotions is crucial.